Hi, I'm Dr. Singhania from Singhania Clinic, and I'm going to talk about anxiety in children. Anxiety in children needs to be differentiated from normal childhood fears. A child starts becoming wary of strangers from the age of 5 to 6 months. By the time they are 7 to 9 months old, they start getting stranger anxiety. That means they start crying when they see new people in the room. Preschool children fear separation from their parents. This separation anxiety is common, and it usually reduces as the child grows older. In childhood, there is development of a fear of the dark, animals, ghosts or monsters under the bed. Anything new or different can cause anxiety. And of course, teenagers can be very socially anxious. The need to be accepted, to be part of the group can give rise to these normal childhood anxieties. So how do we say that these are anxieties and not normal childhood fears? If they are excessive, if all kinds of help that we have given does not seem to allay those fears, or they impact the child's social life or academics and going to school, then we know that this is more than just normal childhood fear. What are the causes of anxiety? Often there is a slight genetic overlay. Children who have what we call behavior inhibitions as toddlers and young preschoolers are more likely to become anxious as they grow older. These are children who have a high arousal, so they get very quickly anxious, they may be withdrawn, and they need proper identification and treatment. Excessive maternal worrying, or a mother who's depressed and thus unresponsive to an infant, can give rise to anxiety. Parenting styles, over controlling parents or over worrying parents can cause anxieties. Environmental stresses, bullying, or child is unable to do well in school. 70% of children with learning difficulties and ADD have anxiety, and 28% may be associated with depression. Effects of a mobile society are particularly important in this part of the world. As a family relocates often, the child will lose their friends, the comfort of a familiar bedroom, their ties to the community, and they have to go to a new place, learn new customs and values. And there are these hidden rules in schools. One are the overt rules, and then there are hidden rules which are difficult to decipher. Making new friends, dealing with new academic curricula is difficult and can produce anxiety. Now, anxiety can take many different forms. There is the separation anxiety disorder, where a child who is much older than preschool fears separation from the mother. And I've seen children who refuse to go to school because they are so afraid to separate from the parents. Phobias, that is severe and significant fear of a particular item like dolls or spiders. Social phobia. I had a child who had severe acne, and she became so fearful and anxious she could not meet people. She would hide in her room if there were visitors in the house. Obsessive compulsive disorder, OCD, is a well-known anxiety disorder now recognized in children. Generalized anxiety disorder, where a child is anxious in almost every situation. And of course, a very unknown one called selective mutism, where a child refuses to talk in school though his language development is normal and he speaks well at home. These are all different types of anxiety disorders. If you're seeking help, please visit our website www.singhaniaclinic.com or call us on the number shown below. Thank you for watching.